started your timer and here is your question. Right, so if you have read and understood, considering the clinical examination station, kindly begin.
Yes, ma'am. Good evening, ma'am. Okay, I'll walk into the station. I'll wash my hands and then I'll introduce myself to the patient. Good evening, ma'am. I am Dr. Abbas, candidate in the exam. I've been asked to examine you. Can I confirm your name and age, please?
Yes, I'm Samantha, 62 years old. Continue, please.
Okay, Samantha. Can I call you Samantha?
Yes, please.
Okay, Samantha. I'll be having a look at the swelling on your neck. It will involve me looking at it. Then I'll touch, and then I would also listen to it, and then I would also give you a few instructions. If at any point during the examination you feel any pain, let me know. I'll be as gentle as possible. But if you feel any pain, let me know. I'll stop. Or any discomfort whatsoever. Samantha, I would like you to sit down while I do the examination. I would also like you to remove your and then remove the upper portion of your chest examination. If that's okay with you. Okay, so I would like to commence now. So I would stand in front of the patient. I would inspect the neck, look at the sites of the swelling for the swelling, and then I'll look at this. I would also look from the side. Then I'll look for the presence of any scar, any distended veins over the swelling. I would also look for presence of lobulations over it, any other swellings in any other parts of the neck. I would also check the side of the face for the parotid gland region and also the submandibular gland area. And then I would also look at the hair to see if there's any hair loss or if there are any swellings of the scalp. After this, I would start my palpation. I will instruct the patient, before palpation, I'll instruct the patient to swallow. And then giving her a cup of water. And then I would also tell the patient to protrude her tongue to see if the tongue moves on swallowing or on tongue protrusion. And then I would also tell the patient to, after this, I'll check for differential warmth over this. I'll start my patient, I'll ask if there's any pain, and then I'll check for differential warmth, and then I'll palpate for tenderness. After which I'll measure the size of the swelling, and then I'll palpate for centrality of the trachea, and then I would palpate the surface. Then I'll go to the back and continue my examination. While at the back, I'll tell the patient I'll hold on the swelling again and tell the patient to swallow. And then I'll tell the patient I'll tense the sternocleidomastoid on each side. And then I'll tell the patient I'll try and move the swelling again to see if it moves with that way on both sides. And then I'll palpate for the lobes of the thyroid gland or of the swelling, if it's multilobulated, if it's a thyroid swelling. And then I'll palpate for the extent and then fixicity to the skin. And then I'll then ask the patient I'll check for the carotid pulse on both sides individually, and then I'll start palpating for lymph nodes. Sorry, I'll palpate for lymph nodes, and then I'll then listen for the carotid bray. And after which, I'll palpate the scalp of the patient and also check for tenderness along the spine or swellings or any deformity on the spine. Then I'll come to the front, and then I'll tell the patient to raise her shoulder to see if there is any proximal myopathy. I'll then check also for flapping tremors. I would check the patient's pulse and check the blood pressure. I would also check, I'll do a deep tendon reflex and then check for pretibial myxedema. Sorry, before then I'll check the fingers for finger clubbing, and then I'll and then other thyroid acropathy and wasting of the tenor epithelial eminences. I'll check for pretibial myxedema. After this, and then I would ask the patient to walk to assess her gait.
Anything else you're missing?
Okay. Yeah, I'll check for thyroid eye signs. Sorry, ma'am. Yes. I'll check for eye signs. So I'll inspect the eyes to see if there is lid lag or lid retraction. I'll check for the extraocular muscles, for their mobility, to check for weakness of the extraocular muscles, and then I'll check, do the Navziger sign for check for proptosis.
Yes. Leg, you'll examine the leg for what?
Yes, for pretibial myxedema, ma'am.
Yes, and ankle reflexes and proximal reflexes. Okay, why would you ask the patient to stand up from sitting position with arms crossed? To rule out
check for proximal myopathy.
Muscle, yes.
And then, yes, proximal myopathy.
All right, good. Can you present your case now?
Yes. Yes, ma'am. Thank you, ma'am. I've examined Miss Samantha, the 62-year-old, which was 5 by 7 centimeter in size. The swelling was regular, smooth, was moved with swallowing, but not with tongue protrusion. She had, it was firm, attached to the overlying skin, and was, however, was not attached to the underlying muscle. I could get below the swelling, and carotid pulses were palpable on both sides. There was no thyroid eye signs, no brie over it, and there's no thyroid eye signs, and no proximal myopathy.
Was there any lymphadenopathy?
And no asterixis, no lymphadenopathy.
Okay.
Yes, ma'am.
So what are your
differential and no asterixis?
Yes. What are your differential diagnosis?
Yes, ma'am. I think she has a simple multinodular goiter.
Yes.
However, it can also be a controlled toxic. It can also be a controlled toxic goiter.
Yes.
She could also have a lipoma of the anterior neck. It can be a thyroglosal cyst. It can also be a lymphoma of the thyroid gland.
Okay.
And then it can also be a dermoid cyst.
How do you plan to manage this patient?
Yes, ma'am. To manage her, I would like to investigate by doing a X-ray of the soft tissue neck. I'll do ultrasound guided fine needle aspiration cytology of the swelling. I would also I'll also do thyroid function tests for the patients, and then I would investigate preoperative investigations, including chest X-ray, ECG for the patients, and then full blood count serum electrolyte creatinine. Then treatment depends on my finding. For a simple multinodular goiter, I would offer her for the indications for surgery will likely be for cosmesis. So I'll offer her total thyroidectomy with levothyroxine replacement, and in situation or a subtotal thyroidectomy, or depending on which lobule of the thyroid gland is enlarged, I may offer her a hemithyroidectomy.
All right, good. Yes. Who would give feedback? When you were doing inspection, do you remember to, have you missed anything which was important in this case?
I'm not sure.
What about the neck veins?
Yes, I asked for neck veins.
Okay, you checked.
Yes, I checked for neck veins. Yes, ma'am. Neck veins, scar size.
Yeah.
The size.
When you were doing palpation, then did you check for the trachea?
Yes, I did, ma'am. I checked for
centrality. Since you will be examining the patient, so I have to rule it out if you understand. Once you'll be palpating the lymph nodes, which areas would you palpate the lymph nodes? Because you didn't mention this.
Yes, that's true, ma'am. Sorry, ma'am. I'll check the supraclavicular region.
Yes.
I'll check along the anterior border of the sternocleidomastoid, that's the anterior cervical lymph node. I'll check the submandibular, submental, preauricular nodes, and then occipital and the occipital lymph nodes, ma'am. Yes,
and the post-auricular as well, submandibular, submental, all these. Okay, and then once you'll be doing percussion, so you have to percuss the sternum as well to see the extent of the thyroid if it goes below. So rest, you remember to do all the rest.
Thank you very much.
Yeah, good. Anyone else? If they have come up with any. Yes, Dr. Karma. Yes, please.
Thank you, Dr. Abbas. It was a very nice examination. If I was the examiner, you are sure we pass.
Yeah.
Still then, few things maybe I didn't hear or you missed, and few of my doubts itself. Regarding the examination, when he was palpating, few things he did from the front and then rest he did from the back. So how is that, ma'am? Like, can we do everything from the back?
No, you have to come and do certain things from the front, but then there is a criteria, there is an ethic. Once you have to go behind the patient and examine, then you have to tell the patient that I'll go behind and I'll be doing it quickly. That he forgot to keep the patient with him, like he didn't inform the patient that he'll be doing it.
And did he examine, did he look for exophthalmos?
Yeah, I reminded him and then he did. Lid lag and all that, yeah. Because he was doing it hurriedly. He did well, but then there is room for improvement, definitely. So he...
And percussion?
Yeah, he did. Or I told him that he did, but I told him that he has to do percussion of sternum.
Okay.
Yeah, good.
And there will be a glass of water at the site on the table.
If there is not, then ask for it, that you need it. But I'm sure it would be there. Yes. 2 sips you have to ask the patient to take. Good, thank you.
Thank you.